everybody. It's great to have you all here tonight. And this is Heart at Work. For anybody that hasn't been on before, it's a great way for us to get to hear from our local resources here in Bergen County, as well as hearing from the police that serve our county. There's 70 different towns. We have a lot of police that do a lot of good works when it comes to helping our community. And they are all the first responders on the scene at overdose calls. And we can't thank them enough for all the time that they have spent in helping us just recover Bergen County and saving lives. And unfortunately, there's times then we don't get a chance to save lives too. And I can't even imagine the toll it takes on our police officers. It's so important that we get to hear from them and hear of what they do to help their communities and how they can help them find treatment, as well as just help prevent, because they're in the schools and they're helping the kids and their communities. And it's just alumni in recovery is about people speaking openly about addiction, overdoses, substance misuse, and we love to connect communities. And tonight we have a really good program with some wonderful resources. We always have Prosecutor Musella, who's the Bergen County Prosecutor, and we have the Center for Alcohol and Drug Resources here, and they are going to tell us about what they do for Bergen County. And we also have Bergen Newbridge Medical Center here as well. And Dee Gillen, who's the founder of the Black Poster Project and a partner with Alumni in Recovery, always comes on and just kind of gives us a little update of what she's been doing and where she's been. So I think that tonight is a really important night that we're here. My heart goes out to the people that in that tragic group overdose situation that happened at Riverside Square Mall in Hackensack yesterday. Thank God that we have the ability to revive people in these days. We just never know who's going to fall victim to, fentanyl-laced, potent opioids, and all these people were revived and able to get care. And this is the tragedy of. There's so much to it, and my prayers and go out to the families and the people themselves that had to experience an overdose like that. But it also affects so many people. It affects the families and the victims, and it affects the people the passerbyers that come along and want to help, and then all of the first responders that show up at the scene. It's just, there's such a ripple, the employers, their friends, and this is what happens with addiction. This is what happens with overdoses. And we're in the middle of an epidemic, and we have to help people, and we have to treat it like an epidemic. And that's why I'm so pleased that everybody takes the time to come onto this program and speak and encourage community to get involved. Because what I've learned as a woman in recovery, that we need to constantly be reminded, not reminded, but to be able to keep it fresh and help others and be of service and create purpose out of our recovery. But at the same time, we have to remember that this is a disease process that would like us to just forget that there's a problem and to go on to the next thing. And this is something that deserves our attention and some repetitiveness. So this program itself is recorded, and people can watch it afterwards. And it's a great learning tool because we get to hear from people in our community. So I am not sure if Prosecutor Musella is here. Is he in the room? And Cheyenne is helping us tonight with the program. She's helping me host this. So she'll be unmuting everybody as it's time to speak. But
he's getting on.
Oh, way to go, Ellen.
So he should be there any second.
That's great. Yeah. I'm really happy to say that we do have the Center for Alcohol and Drug Resources here tonight, and that's Ellen Elias. She's helping us make sure that Prosecutor Musella is getting on right now, and he helps lead all these presentations. We've been doing this for about a year now, and we reach out to as many of the police departments as we can. So like I said, tonight I'm excited that we have Woodcliff Lake and Lodi here to be able to talk about what they do. And so with that, I think the prosecutor is just about here. Prosecutor Musella is always very helpful with all the events that we put on. And I have to say that he's always shows up at the Black Poster Project events, and is very helpful in making sure that we get our message across as a community. All right, so I think that he's here. And Prosecutor Musella, are you here? Hello? I'm not sure if he's on yet.
Ellen is saying 1 minute, and I think he'll be on.
I think I admitted him. And all right. Anyway, Cheyenne, as we go on, just help me unmute people because I don't know how to do that so well.
All right, I'm unmuted, but Nancy.
Hello, Prosecutor Musella.
Here I am. Oh, got it.
Hello.
Sorry, I was across the street at a Women's History Month celebration with the county executive and the commissioners, and it's still going on. I had to excuse myself and run out, but I apologize for being late.
No
but
worries. It's good to have you here.
I heard you talking about me, telling everyone how I don't miss any of these events. So
no, and you even ran across the street
I
just
did,
to get
I did,
here.
I did.
Yeah, thank you. Well, please, if you don't mind, let us know what's going on in Bergen County. Could you give us an update?
Yeah, well, I guess you guys heard about what happened last night at the Cheesecake Factory at Riverside Square. So we did have we had 5 people overdosed. They were on break. I don't have all the facts or circumstances at this time, but it's my understanding that they were employees that were on break and were, I guess, using recreational drugs, snorting what they thought was heroin, and it turned out to be laced with fentanyl. As we all know, 98% of our lab submissions here in Bergen County. I just got the numbers from the state. So 98%. Bergen County is one of the highest, actually. I think Cape May or Camden is 100%, but we have 98% of our lab submissions of all drugs, other than marijuana, have been, and especially heroin. I think the 98% is the heroin. 98% of our lab submissions on heroin have come back to include fentanyl. So fentanyl was involved in last night's incident, and apparently the officers, again, thank you to the hard work of the officers from Hackensack. They were 4 of the individuals were Narcaned, 3 responded immediately, and 2 did not. 2 were it's the 3 that did respond to Narcan actually denied being transported to the hospital, denied receiving any type of treatment or help or connection. But the other 2 were brought to Hackensack Hospital. It's my understanding that they were both given Narcan at the hospital as well, and I believe that both are recovering. 1 is still in the hospital. I believe 1 is out. But you know, again, I mean, it really just underlines the importance of the work that the police, the men and women in law enforcement are doing here in Bergen County, and it also really highlights just what we know, all of us know that deal with this every day, that fentanyl is in everything. It's in the pills on the street. It's in heroin. It's in cocaine, methamphetamine. We're also now seeing heroin cut with xylazine, which is a horse tranquilizer as well. We thought that was really only focused on southern New Jersey, but apparently it's now here in Bergen County as well. So that's what's going on in Bergen County. Other than that, I'll talk about a little, the numbers that we've seen from last year. I know, Nancy, I spoke at Bergen Regional Medical Center. I saw you and Dee at the Black Balloon Project. I believe it was last Sunday, maybe 2 Sundays ago. And I spoke to the group that was assembled there. And again, my comments are usually the same when I get on these events. First off, I want to thank Nancy. I want to thank Dee. I want to thank everyone at Alumni and Recovery for inspiring us and for holding these events. These events are very important from a law enforcement standpoint because I believe that they bring us together. They highlight the problem that we're having. So and they also help end the stigma. We're all in this together. We have to fight this fight together. But it's events like this that bring us together. It gets us talking about opioids. It gets us talking about the problem that we have with fentanyl, and it just really it highlights the situation surrounding this crisis. What I tell everyone at these events is that for the first time, the CDC announced that drug overdose deaths in the United States surpassed 100,000 persons in 2021. And New Jersey was one of these states where our young people died, and drug overdoses now are killing more people than car accidents, the flu, and gun crime combined. So we have to think about that. We have to think about these numbers, and these numbers are our loved ones, our children, our brothers, our sisters, our parents that are dying from this horrible disease and this epidemic. So I come on these programs because I want to thank the law enforcement officers in Bergen County for the work you do every day. Boots on the ground. You're at the front lines of these fights. I actually was at Operation Helping Hand last Friday morning. I was talking to the troops, and again, I'm here to encourage you. I'm here to tell you how proud I am, and that we are making a dent. We are, it seems like sometimes we're spinning our wheels because it just, as you're going to hear in a moment, the drug overdose deaths in Bergen County increase every year, despite our efforts. Okay, despite everything that we're doing in the recovery space, despite everything we're doing in the prevention space, the interdiction space, and the education space, numbers are still going up. So I'd like to just tell you all, and again, most of you know, but I like to say, tell you what we're doing in Bergen County. Our narcotics task force is at the bridge every day, along with Homeland Security, the DEA, the FBI, Fort Lee, and we're intercepting drugs, guns, and money every day. So we're trying to make a dent in the traffickers. We're trying to arrest the traffickers, and we're trying to arrest the individuals that are distributing drugs, and we're trying to seize these drugs so that there are less drugs on the street. We're also in the schools, or we're in the 8th grades, the 9th grades, and the high schools, talking to our young people about pathways to addiction. I have 2 officers every Friday in the high school in Bergen County talking about the dangers of getting addicted to prescription medication after a surgery, or the dangers of getting addicted to medication through pathway to addiction, such as experimentation with alcohol or drugs or pills or marijuana, whatever the case may be. So we're trying to educate our young people. And the third thing we're also doing, we're working with our county and our local departments, trying to have drug takebacks. So we're trying to get the word out there that people should clean out their medicine cabinets, not leave opioids in the house, unused opioids or expired opioids in the house, because this is very dangerous. They aren't to be shared. They can fall into the hands of children. So we're trying to, encourage people to use their local police department drop boxes. And I believe like last year in November, the number was something like 700 pounds of unused prescription drugs were turned into Mawa alone. It was something crazy like that. So, that's 700 pounds of opioids that would be on the street if not for this program that we're trying to spearhead with our local police and with our partners such as Nancy. So the other thing, and with the Bergen County Utility Authority is taking the lead on that as well. The other thing that I like to talk about is connection. So that's our interdiction part and our prevention part. Our connection part, we try to attack it from all different angles. This is a multifaceted approach. So we have Operation Helping Hand, where we go in. We have 4 times a year we do these events where we go to open air drug markets. We try to arrest Bergen County residents. We bring them back to our headquarters in Paramus, and we have a recovery specialist, patient navigator on the scene, and we try and get them into treatment. We've learned that they'd rather speak to a patient navigator or a recovery specialist, someone in the field of recovery, than speak to a police officer. We found that it's also more successful. That model is more successful than the old model of having a police officer talk to them. We try to treat them with dignity and respect, and try to explain to them that we realize it is a disease and that we will work with them. And we're trying to offer them treatment instead of prosecution. Try to treat them like victims. I also want to tell you that police officers in Bergen County last year deployed. All police officers in Bergen County carry Narcan. Last year, police officers in Bergen County deployed Narcan 364 times. It's basically once a day. There were 700 overdoses in Bergen County last year. 155 of them were fatal. So again, that's 155 of our young people, our brothers, our sisters, our children, and our parents that succumbed to a fatal overdose. And those are the numbers are going to be even greater this year. We don't have the numbers yet, but we see we're on pace to outdo those numbers as well. So, but every time Narcan is deployed by an officer, a patient navigator again is called to the scene. Recovery specialist is called to the scene. A patient navigator is deployed to the hospital and try to talk to these people and try to get them into treatment. That was done yesterday. I don't know if any of them accepted treatment. I know that again, 3 declined to go to the hospital. 2 were taken there basically because they had no choice. But I will let you know if I'll follow up with you, Nancy and Ellen, and let you know if anybody accepted treatment. And maybe you may have that information for me. But you know, it's important because again, it's another way that we can maybe get people into treatment. And you know, so what you're hearing here and what our plan is that we want to any connection that we have, any law enforcement connection with a person, whether it's an arrest, whether it's a overdose. Also, you know, you can walk into any police department now as part of our HEART program and turn in your drugs. Loved ones can call the police department, report on a loved one that is using, and we're not going to arrest you. We're going to offer you treatment. That's the approach we're taking now. The approach is to try and offer treatment instead of arrest and prosecution. So these are ways that we're trying to connect people to treatment. The other thing I want to talk about is our diversion programs. We started the diversion program in Fairlawn when I was a public defender. I wasn't even the prosecutor yet. I know Ellen was involved in the early planning and the early organization of that program. That diversion program has now morphed into a county-wide regional program. So in municipal court, it started as a municipal court diversion program, but we also extended it to a time of arrest. So all officers in Bergen County have authority from the prosecutor's office at time of arrest to offer someone treatment instead of prosecution. We want to try and connect people to treatment as early as possible. We felt that even at time of arrest is better than time at court when they get called to court, which may be 2 or 3 weeks later. But I'm also happy to tell you that we have secured funding for a central municipal recovery court, which will be basically all the 70 municipal courts will send their cases to this one municipal court where we'll have patient navigators and recovery specialists full-time. We'll have a prosecutor from our office there. And we're going to, the idea is to try and get these people into treatment as soon as possible. So again, as you can see, we're trying to connect and divert people so that we can help save lives. So the other thing is we have a hotline as well, 1-800-STOP-THE-ODs, and we have found that this has really been to date one of our most successful programs. We have over 500 people. That is 83% of the people that have called the hotline have been connected to treatment and have accepted treatment. I don't know how many people have stayed in treatment, but that's over 500 people, and that's 83% of the people that called the hotline. So that is, you know, again, we're trying to think outside the box it's partnerships with people like Ellen and you, Nancy, and conversations that we have. And that's why events like this are so important, because we talk about it. We come up with different ideas that we can attack this problem. Like I said, it's multifaceted. We have to continue to think outside the box. We have to continue to work together. And we're open for all suggestions. The Bergen County Prosecutor's Office is here to help you. I'm proud to be partners with you and other organizations like you. I want to mention our partners, and our partners are the County Office of Drug and Alcohol Dependency, the Center for Alcohol and Drug Resources, Bergen County Newbridge Medical Center, the Black Poster Project, Alumni in Recovery, New Jersey Recovery Advocates. And these are the partners that we're working with every day. And I draw inspiration from you. It's events like this where you really draw attention, Nancy, to the good work that the law enforcement officers in Bergen County are doing. And it's nice once in a while to hear that we're doing a good job, and that we're trying our best, and that we're appreciated. And I can't thank you enough, Nancy, for having this event. I will always be here at this event. I will be at these events. I spoke with the students at Ellen's Ellen's college class at Ramapo last week. So with Liz Rabine, my chief of community engagement, we want to get out into the public. We want to be able to reach as many people as possible, and we feel that hopefully that we're doing some good, and hopefully we can save one life, at least one or two or three people a year, and then it makes it all worth it. So again, I can't thank you enough for the work you do, and I just want to say thank you to the men and women of law enforcement in Bergen County. If you guys need anything, please reach out for us, and we will help you in any way we can. Thank you.
Thank you so much, Prosecutor. It's so important. That I love that the term knowledge is power. And I really believe that the more that we are all equipped with just knowing the facts of what's going on, and just encouraging the general public to just come on it and watch this program and watch the recordings of it, you can't get enough of it. And it's really important to know where we can get help within our county. And I encourage everybody that is wants to share their information in the chat, please do. It's really important to keep these connections going. And thank you again, Prosecutor, for coming on and speaking all the facts of what we need to know. Thank you.
And Nancy, again, I can't thank you enough, because I just think the public needs to know what the men and women in law enforcement are doing in Bergen County.
I agree. I so agree. And that's why we're so blessed to have two great officers on tonight, from two different police departments, because really need to recognize the work that they're doing. And we are going to start with Detective Simon Sherfer from Woodcliff Lake. He's here with us tonight. Hi, Simon. I think we have to unmute you, maybe.
Got it. Hi, Nancy.
Hi.
Thanks for having me this evening. In preparation tonight, I was thinking about, what we spoke about, all the various programs our department does, and trying to prepare my notes. And the one thing I've repeatedly heard from people inside and outside of our community was, it's Woodcliff Lake. Nothing happens here. And that couldn't be further from the truth, because like you spoke about, the opioid epidemic, it's everywhere. Drug abuse is everywhere. Addiction doesn't discriminate. It doesn't care about your age, your gender, your race, your religion, how much money you have. It affects all of us. And we see it in our community all too often. Normally when we interact with people, a lot of times when we get there, we get that call, it's too late. We respond to a scene and we see people at their worst, at their lowest points. And the conclusion to that, it's usually not favorable for them. They could get arrested. They could have to go to the hospital, involuntarily, because they're a danger to themselves. And it puts a negative stigma on law enforcement. It prevents people from wanting to speak to us, prevents them from wanting to call us, second guesses them. And we're not looked at as a resource for them, because we're strangers to them. So we try to tackle that on two fronts. We try to combat that stigma on one front with, we hold community days. We have open houses. We have events where we invite the community, people from our town, neighboring towns, come interact with us. It's a relaxed environment. They can tour the police department. They get to speak with our officers. And most of those conversations, they take a turn from starting with law enforcement, of the law, talking about the department or our uniforms, and then they go into personal conversations and they start to see us as people. And it's less of a you're a cop or a police officer, and more you're a person in our community. You're a parent, you're a participant, you coach, you participate in the PFAs, and that helps build that bond. We do breakfast with a badge. We participate in the drug take back program that Prosecutor Musella mentioned, where we set up an area people can bring their expired drugs, their leftover drugs, to kind of get them out of the house and get them off the shelves. And this helps build that community, so we're not strangers anymore. We're Officer Simon, we're Officer Mike, and they start to see us more as a resource, and they'll be more likely to lean on us and help them get those first steps when they need that help and they're not sure who they talk to, or they're embarrassed to tell their family, or they don't know where they can go. We build that bond to help them take those first steps. My role in the department is, like mentioned, I'm the juvenile officer. I run our LEAD program, and I'm a strong believer in educating the youth of today and to help them prepare themselves for the future. The fifth grade LEAD, we go to the schools, we talk to the kids, we educate them on avoiding drugs. We give them tips and strategies for peer pressure, because normally it's their peers that lead them down that road to the beginning. They want to look cool. They have a boy or girl they like, and they get asked, hey, try this, drink alcohol with me, try marijuana, try something that they don't know how dangerous it could be to them. So we try to educate them on that. From there, we actually spiraled into a real positive path. We started getting phone calls from parents, and they said, hey, it was great you're doing this fifth grade program, but I got kids going to the high school, and I don't know how to prepare them. I don't know what to say to them. They don't want to talk to me. I'm their parent. I'm not cool. So we went to our administration and we started a program in the eighth grade, like a pre-high school talk, where we come in, where we're dressed a little more down in polos instead of our uniforms. We talked about various topics, social media and cyber safety, and we tackled the drug conversation. The fact that they're going to be given more freedom as these high school students, and they're going to go to house parties, and they're going to have less parental oversight, and they're going to encounter drugs, alcohol, and that peer pressure is going to hit them a little harder. We make them understand that there's a responsibility of these young adults at these parties, at these events, that overdoses are constantly happening. What do? Right? They panic. Should we call the cops? Should we not call the cops? I don't want to get in trouble. So we tell them about the Good Samaritan law, and we have them all write down 3 anonymous questions on a piece of paper. They fold them up, mix them all up, they pass them to the front. We read them and we go over them. And at first, we were a little nervous that they wouldn't take it seriously, but the questions were fantastic, right? They were just awesome. We saw their actual fears, right? Their fears about going to school. Are there drugs in the school? How do I avoid that? How do I avoid not looking cool in front of my friends because I'm scared and I don't want to? So we give them all kinds of tips and strategies, and we can see, we start to see they drop their guard, and we see what they're really afraid of, and we try to help them combat those fears, especially around that topic of drugs and alcohol. This year, we overlap with the Parent Academy, which is an educational program. It's designed for parents, focused on the parents to address the topics that are important to the kids, primarily social, educational. So we did a talk about alcohol parties with the parents. We talked about the legalization of marijuana, the rules. We talked about alcohol, parents holding these parties, and we spoke to the kids about it as well to kind of prepare them so they know the outcome. And we feel like this conversation, it opens that conversation because the parents spoke about it, the kids spoke about it. It's fresh in their minds. So it opens that convo at home because we kind of tell the parents, hey, these are the key things you should say or you should do to start the conversation. You have to worry about being the parent and you're not the cool one, right? And it might open that door so they'll speak to you a little freer. We also work with the Hills and Valley. We love them. Constantly working with the Hills Valley Coalition. It's a group they're made up of local educators, business owners, the police, the parents in our community. And we talk about what's going on in our community. It's not just our police departments, local police departments, and how we combat the drug, the epidemics, what we can do together to live promote a healthier lifestyle and a positive outlook for everybody. And I know the Hills Valley Coalition has an event coming up in April. They have a mental health resource. And I think, Nancy, you have a flyer by any chance?
Yeah, we do. Cheyenne, could you put up that next screen, please? Thank you.
It's an awesome resource. Different community resources, county resources. A lot of them are nonprofits, a lot of them are free. that combat all kinds of different drug abuse, substance abuse, addiction, mental health. It's opened my eyes. I found tons of resources that I didn't have before when I started going there, and just opportunities to branch out to help people that come through our doors and say, I need this. Can you provide it to me? And it's easy for me to say, yes, here, you took the first step. Let me guide you the rest of the way.
Yeah, that I have to say the Hills Valley Coalition is a great team of people within, Pascack Hills and Valley, Montvale, Rivervale, Hillsdale, Woodcliff Lake, and there's just so many people sitting at that table, that are trying to help their community with addiction. But if, this is a great event, and I encourage, we're going to be there at the fair. And Marcy is going to speak. She's actually, Marcy Hopkins lives, I think she lives in Upper Saddle River, maybe. Anyway, but she's a local person, and it's just going to be a great night. And it's a really good opportunity for people to come out. Thanks for mentioning that.
Absolutely. Thank you.
Yeah. Okay. Thank you for coming on. Okay.
Thank you.
Our next police officer is Lieutenant Anthony Mobilio, who is, I had the pleasure of talking to him beforehand. I love the fact that he works alongside the Center of Alcohol and Drug Resources in their, in the ShopRite parking lot at the pop-up table. And I can't wait to hear what Lieutenant Mobilio has to say about his department. Thank you.
Good evening, everyone. Thank you, Nancy, for having me. Prosecutor Musella, I know we worked together in the past. For me, I've been I'm in my 25th year as a police officer here in Lodi, and maybe I'm a little different than Simon, but I was born and raised in Lodi. I still live in Lodi. So for me, being a part of the community relations unit here in Lodi, it holds a lot of water for me because I'm like a third generation Lodi resident, I guess, because my parents were here, the whole Lodi thing. And I take a lot of what I do to heart in Lodi. And with regards to the education, like Simon had spoken about, we also here in Lodi, we do also go to the 5th grade classes, and we are involved in the LEAD program. I don't know if you guys all know what LEAD stands for. So it's basically stands for Law Enforcement Against Drugs. Most communities now, I think, are going from what used to be DARE into LEAD. And I think it really is, because I've been in the school system probably for over 20 years also. We did DARE, we're doing LEAD now, and there is definitely a difference in the curriculum between the two. Like Simon said, we go in there for 5th grade. We really try to drive home a lot about speaking about goals and decision-making and emotions that they may have. So, to me, I think the LEAD program is probably one of the better over DARE, and it seems to really work. But I will say this, we've been doing it now. Like I said, I've been in the schools for over 20 years. And, it breaks my heart when I see one of my students now having issues with addiction and having problems with substance abuse. And it breaks my heart. But, as a community policing officer, I do have to say that I do show a lot of empathy with those people, and I do try to have a sit down with them. That was on my own. Now, within the past year or so, I have the help of Ellen, Katie, Jess, and I have Brendan, and they're part of the center. So once a month for just about a year now, we have been setting up pop-up sites within the community somewhere in Lodi. Since it's been cold, we've been going to the ShopRite, and we're in their vestibule. And like Katie said before, today, we just did it this morning. They were really very active. The ShopRite in Lodi is always busy, so they're always getting people to come up. Either a lot of times people just want to give donations, and they're more about just donations, that they want to reach out and help those that are in need. So really, between Katie, myself, and Brendan, we've really done a lot within the community with regards to substance abuse. We've also been, last year when the weather was nice, we did a walk and talk where we went out through the community and we just walked through the community handing out flyers. And if anybody was there to speak with them, we would speak with them and try to get them involved in the program. Or even if they knew anybody that may need help or need assistance, they were there to help them. So they have come into the community of Lodi, and I'll be honest with you, I thought it was really, really a great program. I also am fortunate enough that we have a younger chief here, and he's very proactive, very community. He's also a Lodi guy. He's very community active, and he wants the best for the community. And I think that the center has really helped us with that. And I just want to say thank you to Ellen and her team there. And I think, Nancy, one more thing. I think you went
Sure.
to the Lodi High School today, correct?
No, we're gonna go there on the April 4th and 6th.
okay. Yeah.
The student assistant counselor has a alumni and recovery come. We've been there pretty much, I don't know, since the beginning, around 2015. She started
Yeah.
inviting us in, and it's great.
Well, like I said, when you get there, we do have a school resource officer up there. His name is Detective Castro. He is super involved in that school. So really, he takes a lot of the burden off of me with regards to the high school. He is very active up there. So when you do go up there, it's Detective Castro. Yeah.
Okay, that's awesome. We'll introduce ourselves to him. Thank you so much.
You're welcome.
It's great having you.
Thank you.
Thank you. We have the pleasure now of introducing the team from the Center for Alcohol and Drug Resources, led by Ellen Elias. I know that she'll be getting to speak first. And I just want to say one word about Ellen. Ellen reached out to me back when she started putting together peer recovery support services. And she was very much a pioneer in that here in Bergen County, if I can say that. She'll correct me if I was wrong. And after Ellen, Jessica will say a few things, followed by Kathleen. So I'm just going to let them go in succession that way. And I'll start with Ellen. Welcome.
Thanks, Nancy. And I have to say thank you really for bringing everybody together, because these events are so important. It can't be stated enough times. It is with such gratitude that I have, where you bring together law enforcement and we get a chance to highlight all of their great work, and kind of stepping back is a lot of the great work that you do. Stepping back, a lot of the work that we do is in partnership with law enforcement, from the prosecutor's office under the leadership of Prosecutor Musella, as well as with the local PDs. So I want to talk to you a little bit about the Center for Alcohol and Drug Resources, which is a program of Children's Aid and Family Services. So the center has been around for over 40 years. I've been with them for 25 of those 40 years. And we have two major aspects of it. We have prevention and we have recovery support. So the importance of prevention can't be underscored enough, is that we need to go upstream and try to do what it is that we can do to prevent people from coming to the place that they end up needing to go to treatment and in need of recovery support services. So we have programs that are in more than half of Bergen County's schools, evidence-based, curriculum-based programs, but we also have programs that are designed to change policy and to do some public awareness, public education. So just as an example of that, with the legalization of cannabis for adult use, we started a campaign which is all about safe storage of edibles, and it's been co-sponsored with Englewood Hospital as well as with the Poison Control Center. So these safe edible storage posters are now going statewide through the Poison Control Center. So this is how we kind of raise awareness, not only in Bergen County, but throughout the state, because this is such an important issue. And what we do is really in response to what the needs are in the community. So just even talking about a response, so you're aware of what was stated earlier about recovery support services, where we have peer specialists. And I'll tell you a little about the overall of the programs, but in response to what occurred yesterday and what happened last night, Jess was able to go over to Riverside Square today and provide them with hotline cards, 24/7 hotline cards, and to provide them with Narcan, so that out of a tragedy, hopefully we can prevent another one, right? So that's a lot of the spirit of what it is that we do to address the issues that occur big picture, but also as they emerge, so that it's not like we're not waiting for somebody else to do it. We're just going out there to do it ourselves. But clearly we have major issues. So as Prosecutor Musella said earlier, we do respond to overdoses that occur in the community when someone's brought to the hospital, and that's in partnership with all the local PDs and the prosecutor's office and the 6 hospitals. So just even while we're on here, we just got a notification that there was a person who overdosed, and unfortunately they've passed away. So we get those as well. Also the times that we can go to the hospital where there is that moment of opportunity where we can connect with someone. So there's a lot of tragedy that surrounds some of the work, and our peer recovery specialists are literally angels in that they are so many times in the right place at the right time with the right person, and all of the stars are aligned, and there's an openness to continue moving in that conversation. So we're there when there's an overdose. We're there when there's not an overdose. So hospitals will call us to ask a recovery specialist to come to the hospital and meet with someone who's struggling. We provide long-term assistance. So after someone leaves the treatment program, which is the most vulnerable time for them, is that we provide recovery support services for them for an entire year to help them get retransitioned into the community in a healthy way and part of the recovery community. So of course, Prosecutor Musella mentioned that we are also with the municipal court program and now the county-wide program that's going to be developed. We also have a recovery specialist in the jail. But some of the innovative work that we've been doing is really what Lieutenant Mobilio had mentioned, and that is being out in the community with the community in partnership with law enforcement to create a sense of connection to recovery source resources and educate the community about what's available. And so thank you, Lieutenant Mobilio, for allowing us to do that with you in your community. And with all of that, I'm going to then now pass it on to Jessica Fernandez, who's our Director of Recovery Support Services, so she can tell you a little bit more about some of this outreach work that we've been doing.
Thank you, Ellen. And thank you, Nancy, for having us here. We're very excited and happy to be able to share this with the community, and also alongside, Mobilio and Mark, and also Woodcliff Lake, and really getting a chance to let everyone know what's been going on. So this year, a little different than what's been going on in the past with Operation Helping Hand, we've expanded the efforts a little different with the prosecutor's office. And what that looks like is doing knock and talks out in the communities that have been identified as high risk. And so for that, the prosecutor's office and Jen Rueda and Heather Norman work very closely in vetting a specific list of people who are high risk, because here, people have the option to refuse medical attention when law enforcement is present and at the scene. And so what we've noticed is that there's a repeated amount of overdoses with the same person. And so Jen and Heather create this list, and they reach out to the local police departments to identify, what's going on in the home, who's there, can we go there, is it realistic? And so with that, we'll bring a recovery specialist with the prosecutor's office and a detective. With the local police department, we'll go there, we'll meet with them, and Kathleen's going to share a little bit more about that in detail, but that's one of the things that we started, and we kind of piloted that right before, I want to say right before New Year's, and there were certain outcomes with that will be shared, and then we did that again in February with another list of people. So we went all over Bergen County. We were in Dumont, we were in Lyndhurst, high and low, we're everywhere. And so in addition to that, we're really going in and not only doing the knock and talks with the prosecutor's office, but if there are people who identify as high risk when we go into these towns, we're going there, we're meeting with people, we're contacting them. If they're refusing, we're reaching out. In addition to that, with the community outreach tables that we're already doing. And so those have been very successful. We've been able to do 17 last year, where we were able to go out into the community. And then in addition to that, we're expanding. So South Hackensack looks a little different than Lodi, for example. In South Hackensack this year, what we started was they have the motels that run along Route 46. And so we've worked with the chief of South Hackensack. And so he went to every motel and let them know that we're going to be coming by and going to, hopefully what we wanted to do, which we were able to, was knock on the doors of the people who are at the motels and let them know, you know, we're here. We have hotline information. We have Narcan. We have fentanyl testing kits, and we have a recovery support specialist here if you are interested in, you know, getting help. And I think there's, again, another story that can be shared in detail with that further, but we were able to do that last month, and we also included Ramsey on that. So we went to about, I want to say over 8 motels and hotels that we went to through Ramsey and South Hackensack, and we were able to leave behind Narcan with the management. So in the lobby, there's 6 Narcan in each motel in South Hackensack, and then we were able to put up hotline posters and also let them know that Narcan is available there. So in doing that, we followed up again in March, and that's something that we'll continue to do with South Hackensack. And what's so great is that each officer knows people in other towns, and so they're letting other people know, and it's trickling down into other places. So Ramsey, they're going to Upper Saddle River tomorrow, and there's a lot of other locations that are being touched. So it's really great to work, you know, together with everyone, but it's really become a lot of word of mouth in the community as well, which has been great. You know, in South Hackensack, people are shouting out when they notice we're around, because now our presence is almost, it's expected on a specific day, and they know we're going to be there. So with that, you know, people have been able to kind of keep our name or keep our card in their back pocket and reach out when we're there. And so we're really excited to be doing that. But I'm going to pass it off to Kathleen, because there's a lot of really special moments that have happened out of these specific initiatives. And I want her to be able to kind of share those with you all.
Thanks, Jess. Kathleen Scrivanich, or Katie is fine. I'm a recovery support specialist, a peer recovery specialist at the center for almost 2 years now. So I'm a person in recovery. I get to work with clients one-on-one to help support them in their own recovery journey. And recently I'm taking on and stepping into a new role as our coordinator for law enforcement initiatives, which is definitely an honor. It's a privilege. There's so many great people here tonight on this call, and thank you, Nancy, for having us. It's my first time joining in. And it's just been great to hear what everybody is doing in Bergen County, and to help those in need, because there's a lot of help needed. And just like Lieutenant Mobilio was talking about being born and raised in Lodi, I was born and raised, born in Teaneck, raised in Pagoda, and now I live in Hasbrook Heights, and a lot of things happened in between then and now. But to come back here and to be able to be a part of such great partnerships with so many people from so many great organizations in the community, but especially with law enforcement, and to just see the general interest, compassion, concern, and hard work. And somebody mentioned the boots on the ground, and hard work, heart work. We're really putting our hearts into all of this. And, I really personally one-on-one get to see those results as I work with the individuals that are in need. So just to start with, what we're doing, with some of our community outreach, and Lodi is a great example. Like, we were at the ShopRite today with Lieutenant Mobilio, and we get to see him in action. We get to see, he knows everybody who walks in is saying hi to him. We get to work with him to help the people of his community. And we did have a table. It was August of the end of the summer last year, that we set out by the Family Dollar. And I got a new client from that. Somebody in the community says, I know somebody that could use some help, and came back with a cell phone. She's on the phone, and this young woman became a client. We were able to connect her to treatment, and I have been in contact with her consistently since then and just was able to connect her to further resources this week. So it's just a great example of I was able to meet somebody that was struggling with very similar issues that I had struggled with myself, in a way that I would have never otherwise been able to encounter this individual. And that's really the beauty of what we're able to do at the Center for Alcohol and Drug Resources through these initiatives. We also mentioned some of the knock and talks that we're doing. And, there was one particular knock and talk a few months back where we were notified of a high-risk individual through the Bergen County Prosecutor's office. And I went to that individual's house with a couple of detectives from the prosecutor's office. And we went there solely with the purpose, and a police officer from that particular town met us also to be there. And we went there with the sole purpose of kind of intervening and showing up at this person's door because we hadn't been able to connect with them. They had refused help previously. And we knocked on their door, and I was able to talk to this woman. And it was maybe a week later, a few conversations, and she was able to get herself into treatment as well. And things don't always go perfectly in these situations. Recovery is not necessarily a linear process, and sometimes, and I know that was my experience too, you get help, sometimes you stumble, you'll fall, and and that's again where the center comes in, because we are there to support no matter what. Even if somebody's struggling, we'll continue to reach out and make those calls. And this individual that we met on this knock and talk, I just spoke to her again today, and she's going through some medical issues where she's getting some medical attention for that inpatient. And I'm still able to be there and offer her support as she tries to recover from some of the health consequences of long-term drug use. So again, this is another individual, and we're talking about like some of the people that we help. They're homeless. What we do in Lodi, we do in Englewood, and we meet clients that are literally living on the street, and we get to know them from setting up in Englewood once a month and offering our services. And then, they get to know us, they feel comfortable with us. And when that time comes where they're ready to get some help, we've been able to get people directly into treatment, now into the shelter system, so it ranges from, dealing with people who don't have anywhere to live, and we're helping them rebuild their life in that way, to this other woman I was just talking about, who is a teacher in our community. One of our other initiatives that was mentioned, our arrest program. I've been working very closely with a nurse, an RN who has, worked through the pandemic and, suffered from PTSD, this is a lot of trauma through working through COVID, and found herself, back into the throes of addiction. And it just goes along with how we started off saying that this, this disease, substance use disorder, these struggles, they don't discriminate. And, they show up everywhere. Mothers, daughters, fathers, sons, it doesn't matter. Brothers, sisters. And through our programs, we're able to really reach out to all of these individuals in different ways. And the way that works with law enforcement, especially like, Operation Helping Hand, which was also brought up for when they go into the open market out in Patterson. And sometimes when people get arrested, they do bring them back. And that's where we come in as recovery specialists as well. And we follow those individuals for a year. And we've seen people just completely turn their lives around. We had 2 clients recently come back and share their experience of having encounters with police officers that they say treated them with respect, with dignity, made it clear that they were there, not to persecute, but to offer help, and to be a part of that, and to see the changes that we're making in people's lives. I think it's important to report that because, we do see a lot of tragedy. We see people overdosing and sometimes we see people getting Narcaned and, not always the happiest people about it, that's not the kind of help that they're looking for at that time. But when we stick with it and we continue to make ourselves available, continue to offer the resources, continue to just make it known by our actions and by the hard work that we do, that we're there for people when they're ready to get the help. It really does make a difference. And it's really a blessing and just really special to be a part of this also. I don't know if there's anything else in particular I'm forgetting to address, but.
Oh, you've just added so many good things, so much compassion and care and community outreach. It's awesome. And thank you for giving some feedback about just the good mentions for the police officers from the people that you treat. Thanks so much, Katie and Jess and Alan. Thanks to the center very much for being here and having this tonight. So let's move on. We have a few minutes left, and I really want to hear what Chris Rusk from the director of MAT and recovery over at Bergen Newbridge. And then we're going to hand it off to Dee because I want to hear about the Black Balloon Day event. So thank you.
Absolutely. Thank you, Nancy. And I want to say thank you to Dee and Prosecutor Musella as well. We're very grateful for the partnership with these organizations and with you. And we're also grateful for our relationships with law enforcement and first responders and the work that you all do. So it is a privilege, as I mentioned before, to be part of these meetings. So I'll speak briefly about Bergen Newbridge Medical Center. We're one of the largest hospitals in New Jersey. We're a safety net hospital. And one of the things I will say is that, at Bergen Newbridge Medical Center, it's not just about the treatment, it's also about our philosophy of care. And, when you look at things like inpatient, we offer the full scope and the full spectrum of care, starting with withdrawal management when someone comes in to be able to safely, under, medical monitoring, go through that process and get ready for treatment. And then move, if they chose to short-term residential. We have 2 20-bed units. We actually have one of the largest withdrawal managements, formerly known as Detox, on the East Coast. We have over 50 beds. And so with that, if someone did want to move down to short-term residential, we have 40 beds broken into 20. They're both co-occurring units, but if someone did have some mental health issues that were maybe a little bit more severe and needed stabilization, we can accommodate that as well. Stepping down, we offer outpatient treatment at the intensive outpatient level. That's 3 days a week of group with an individual session, and then they can step down to outpatient as well. We offer medication-assisted treatment where we can provide FDA-approved medications, a number of different types of medications to help manage cravings and prevent relapse for people to sort of supplement and augment their recovery. And the nice thing about this is that I think traditionally a lot of these types of treatments were either very linear or very fragmented. Each episode was kind of this open and shut experience. And what we really look to do is to create this integrated level of care that really flexes with a patient or client's needs, so that as a person is moving through their recovery, they have this very robust menu of options that they can kind of mix and match to support where they are at any given time. That would include, with any of these outpatient services, they could add or choose not to add psychiatry for medication management, individual therapy to help address root causes, or peer recovery options. And just being in a hospital, any patient or client working with us has access, totally barrier-free, to downstream services, which could be primary care, pain management, HIV and Hep C treatment, wound care, smoking cessation, any of these things that promote wellness. And that's really kind of our philosophy of care in a nutshell. And we're proud to be here for the community and to just serve Bergen County and anyone in the state that needs help. Thank you, everyone.
Oh, thank you so much, Chris. Yeah, Bergen Newbridge is for everybody in the county, and it's good to have you. And we had that wonderful event called Black Balloon Day for our 2nd annual, and I want Dee Gillen to talk about that. You there, Dee?
I'm here.
Hey, Dee.
Hi, everybody. I'm just going to take a couple minutes of your time. First, to say thank you to every single person on this meeting. A lot of your faces were at Black Balloon Day, and that we are so grateful for that. Because I always look at this like it's a puzzle piece. Everybody brings something to the table, and together it's a big puzzle that we're putting together with all the no missing pieces, bringing help in any kind of way. I unfortunately, I am representing the what happens at the end of the line when people don't get the help they need, or they think they're going to get help and take that one last hit. And my son is gone for almost 8 years now, so I just really think back and wish that all of this was available 8 years ago, 10 years ago, 15 years ago, when we were dealing with it all. So I think that families like ours, when our loved one dies from this, that, most people, their story's kind of over. We fought for 10 years and then he died, and, we're not fighting the fight anymore. I'm not speaking about me because I'm very involved still, but a lot of people go through that. You guys are all still here doing this every single day. 24 hours a day, you're working your tails off in every aspect. And, there's so many people that are grateful in every way, every one of you, all the different things that all of you do. I think that people don't get a chance to tell it all that often. So something like this is so important because we do get that chance to say, thank you. Thank you for what you do. Thank you for everything you have done. And thank you for everything you're still doing and going to do. It's so important. And everybody is really grateful. So thank you so much. I didn't talk about Black Balloon Day, but
It was
we
a
did
great
have a
day. Look at
we
the
did have a great
picture.
event last week. And
was.
our second annual at Bergen Newbridge. So between the recovery side and then the grieving side, the posters were on one side and the recovery was on the other side. It was such a great event. It was so positive and just so uplifting and so hopeful. So I just wanted to say thank you for that very much.
Oh, I can't hear me. This is a we
Yay,
program. We are
Dee.
doing this together. And I also just want to say that Dee Gillen is getting a prestigious Citizen of the Year award. If you want to come celebrate with her, her great work on
Yay,
April 25th.
Dee.
Woo!
Oh, gosh.
I know, sorry. So, but no. But I love you, and you do amazing work, and you've been doing this for ever since I've met you, and all through the pandemic. That's when you started really going out there with, and it grew, and you help a lot of people. And I know we ran out of time. I just want to ask Prosecutor Musella if he has any final words at all.
Just thank you to everyone on the call tonight. And again, thank you everyone for the great work that you're doing. And like Dee says, just, we got to continue to fight the fight. And I'm just happy and proud to be here standing next to you. All right. Anything you need, please reach out.
Yeah, thank you, everybody, because you're all extremely, valuable people that work hard every day, like everybody said. Thank you to the Center for Alcohol and Drug Resources tonight. Thank you, Bergen Newbridge, and thank you, Prosecutor Musella, and our fine law enforcement officers, Lieutenant Anthony Mobilio and Detective Simon Sherfer. You guys are great. Thank you, and appreciate all you do. With that, we say good night. Thank you.
Good job, Nancy.